Dr. Joel Ernst, thank you very much for joining us for our conversation series. There's a lot to talk about. COVID, certainly, some of the early patients you treated at Zuckerberg General Hospital in San Francisco, all of the work you've done over these years. But this is for the fellows, at least in part, before we get into some of the more topical news. What was it like? How did you actually find the AP Giannini Fellow program in 1984?
I think I heard about it from my lab mentor at the time, most likely. That was Ira Goldstein. And I was relatively new in the lab. I think I had a year of support at the time. And he said, if you're going to keep up with this, you're going to have to come up with some funding for yourself. And told me about the Giannini Foundation Fellowship and worked with me actually on the application. It was the first grant that I had ever written. And, I'm sure that the initial drafts were really, really pathetic. Maybe the final one, if I were to look at it now, I might be a little bit humiliated by it, but at least it got me to the interview stage. And obviously I was pleased that it was funded. So it really helped me get started.
The interview, fellows tell me that was and continues to be a pivotal, significant experience in their research life. What was that interview like for you?
Well, it was memorable, that's for sure. So it was at the Pebble Beach Lodge, and I think there were several challenges. The one was, you couldn't have any pre-prepared slides. You just do it with a paper flip chart and a marker as the only prop. And we were warned about that in advance. What we weren't warned about was that we would be in a boardroom at the Pebble Beach Lodge, and we would be facing the window overlooking the waves crashing into Pebble Beach. And so one of the big challenges was not just staying on point and giving the comments, but was to avoid being distracted by that beautiful scenery and the waves crashing into Pebble Beach.
So what did you do to bring people back to watching and listening to you, or did you?
They must, well, I don't know. I think I just tried to not look out that window too much and sort of stick with eye contact with the members of the board, and the reviewers, I guess, at the time were the deans or their designates from each of the medical schools in California.
That's still the case. Connect some of the dots for you, Joel, if you would. 1984, what happened next, and how did your medical journey proceed?
Well, my medical journey probably isn't a terribly traditional one, given how it's turned out. So first of all, I did not come from a scientific background. There was no one in my family that had any scientific background at all. Somehow I got curious and then sort of ended up going to medical school, but with no, basically my exposure to science was the requisite pre-medical courses. And I enjoyed those. I enjoyed biochemistry in particular, and I thought that was kind of cool because it seemed to explain how things worked. And I kind of kept that with me. And so came to UCSF for my internship and residency and was exposed then to the really incredible scientific environment, biomedical scientific environment at the time. And I thought, boy, I need to give this a try. And so I had some support from my subspecialty fellowship program for time in the lab. And so found Ira Goldstein's. He agreed to let me into his lab, even though I had really no experience. And I had a project, and I had a few people sort of coach me on initial experimental procedures. And at some point, I was terribly inefficient at the bench. And so at some point, probably about 10 o'clock at night, that I finished an experiment that actually worked. And I looked at the result, and I realized right then that I had just discovered something. And I thought, at least until tomorrow morning, I know somebody that no one in human history has ever known. And I thought, wow, this is an amazing feeling. And I think in retrospect, I was just hooked at that moment. There was no turning back. I mean, I don't even remember what the result was. It was probably terribly trivial, but I thought it was important at the time. And that was enough to get me hooked.
The people who are fellows who are joining this conversation with us, that point of discovery where no one else, at least as you mentioned, at that moment, knew what you knew and knew this particular discovery. And then you couple that with curiosity. Those two things work in tandem with one another. For you?
Absolutely. I mean, I think they combine to feed a passion. And I think passion for what you're doing is what gets you through, even the sort of darker times. In other words, when you have a paper rejected or a grant that's not funded, things like that, if you've got the passion for what you're doing, basically say, well, that was unfortunate. Now I have to take the next step. And so I think, that all kind of fits together after a while.
When did you treat patients at Zuckerberg General Hospital, AIDS patients I'm referring to?
Well, I mean, I think I still, I remember what I think was the first AIDS patient at San Francisco General. And that was my first year of fellowship. And we were asked to see a young man with this very unusual cancer that never happened in otherwise healthy young men, Kaposi sarcoma. And that was historical. We didn't really know it at the time. We just thought, boy, this is really odd. But really within weeks, it became apparent that this was not a one-off strange thing. We started seeing similar things, including unusual infections, and really realized at that point that something's happening. We don't know what it is. We don't know whether it's going to turn out to be a big thing or a small thing. We didn't know at the time whether it was just happening around us in San Francisco. And obviously it turned out to be the biggest pandemic in our lifetimes so far. But taking care of patients at the time, I mean, we were really operating in the dark. In a certain way, it was a good time to be a physician scientist because there were a lot of unanswered questions and there were a lot of mysteries. And, I kind of think back sometimes on how things would have been different with the HIV epidemic if that had happened 50 years earlier or even 20 years earlier. The HIV epidemic hit at about the time that we knew that there were CD4 and CD8 T cells, and those were two different subsets, and that they did different things. I think about 10 years earlier, 15, 20 years earlier, we didn't know that there were two subsets of T cells. There were, a little bit before that, we didn't know that there was an enzyme called reverse transcriptase that could reverse transcribe RNA into DNA and become, basically the genome of a virus. And so if HIV had hit 20 years, 30 years, 40 years earlier, I can't even imagine how horrible it would have been. It's been horrible enough. But what we had available in terms of new discoveries and new understanding at the time was just enough to get going.
Do you see parallels with COVID?
There are certainly parallels and there are certainly contrasts. I mean, certainly the parallels are here is a viral disease that came out of the scene. We weren't prepared for it, unfortunately. And it's having a massive impact. I think the differences are the HIV epidemic really, the early impact was relatively confined. It was restricted to certain groups of people at risk. And, it was easy for the federal government to kind of not pay too much attention because it wasn't affecting everybody. In time, obviously, it had a massive impact on science. I mean, I think it had a massive impact on immunology, certainly virology, infectious diseases. I think it's touched really every facet of biological science. I actually think in that way, COVID will have a similar impact. In other words, I think that A lot of the ways we've done science are already changing. A lot of the ways that we communicate science are already changing because of COVID-19. And I think the public attention is greater than it was in the early days of the HIV epidemic. And so I think, as horrific as things are right now, and given the terrific economic impact that it has, I think in the long run, I think the COVID pandemic will actually have beneficial effects on public image of science and on the conduct of science itself.
The 1918 pandemic, one of the things that's been reported on in the last few years is how little was talked about that pandemic and about the flu. People just didn't talk about it.
Mm-hmm.
There certainly wasn't social media. There wasn't the proliferation of 24-hour news. So what role do you think the public, and you mentioned the public, what role do the public play in terms of COVID as you look at it now? Who would have thought that wearing a mask is either a political or a personal decision? So just a sense as to how you view the public and this particular pandemic.
Well, I don't want to go off on a political rant here, but I think it's unfortunate that behaviors have become politicized in our country. I mean, I think that it's about health, it's about life, and it's about economics, no question, but it certainly shouldn't be about politics. I mean, this is an RNA virus that does not care if somebody's respiratory tract belongs to a Republican or a Democrat. It just likes the human respiratory tract, and unfortunately seems to like human vascular endothelial cells and a lot of other things. And so it's really, ripping through populations, communities. But despite the fact that it's prevalent and really broadly affecting communities, it also still has some limited impact. In other words, I think there's obviously the wealth gap. There are the people who could shelter in place, work from home. There are the people who couldn't, and those are the people that are disproportionately affected. And I think that's an unfortunate recurring theme, particularly in infectious disease pandemics. The 1918 flu, 1918, really it lasted, we call it the 1918 flu, but it really lasted into early 1920. And it was also much more public. I mean, in other words, I think there was less knowledge about, certainly not much knowledge about what caused it. But communication was definitely much, much slower. And leadership was, similarly slow. But I think once things hit the community, I don't have the impression that things were nearly so politicized. Just thinking, just as a little diversion and thinking a little bit about my point about how the COVID-19 pandemic will, I think, overall have a positive impact on science. Just one anecdote from the 1918 flu pandemic. There was a young scientist at the time, whose assignment, his project, was to develop better culture methods to recover the bacteria that caused influenza. And so he had the task of developing new culture methods for the bacterium Haemophilus influenza, which turned out not to be the cause of the flu. Now, he did okay because his name was Oswald Avery, and later in his career, he discovered that DNA transmits genetic information. So having a bad project at the outset of his career didn't actually derail him. I found that encouraging too.
When it comes to the current situation with COVID, one of the things that I think the public has been more aware of than maybe in other situations are the numbers, the data, the projections coming from multiple sources in this country, but also, of course, around the world. How do we, as the public now, deal with those projections that are ever changing and really do you stay up on it every day to see the numbers change? Do you kind of step back a little bit? How should the public react to these changing numbers?
There's how they should and how they are. I mean, I think there's no reason to panic. In other words, that's really one extreme response, and being aloof and blasé is the other extreme that you want to that the public should avoid. I think the public needs to appreciate that this is a shared problem. It's not just an individual problem. This is a transmissible infectious disease. This isn't, something that's confined to one person and it's unfortunate. It is a transmissible infectious disease. So I think people need to understand that their behavior not only is meant to protect themselves from becoming ill, but to protect others from becoming ill, and also to protect the society from being overwhelmed with too many sick patients at once, like happened in New York City. I mean, the health system in New York City was absolutely overwhelmed. And there isn't any question that the high mortality in New York City was a consequence of the overwhelmed healthcare system. There certainly were people who would not have died if they had been able to get appropriate, optimal medical care. In terms of the numbers, I think when numbers get large enough, people get a little bit numb. In other words, they don't, 20 million and versus 40 million doesn't really probably strike them as meaningful. I think that when it's in their communities, it's much more meaningful. I think when it touches somebody they know, it's more meaningful. And I think the other thing that is really an important message and that people just don't get is when somebody, let's just say in a state other than California, says, I'm not worried about it. It doesn't affect me. It hasn't even gotten close to me. They're able to say that because somebody else is doing the right thing as a public health approach. And so public health just gets so underappreciated because when it works, nothing happens. I mean, having nothing happen is a public health success. And we unfortunately have something of a public health failure here for a number of reasons, but the public has to be on board or public health authorities can't do anything.
We do quite a few conversations and videos about what it's like to be a scientist, what it's like to balance research and family, perhaps, writing grants, having a lot of our fellows want to have their own departments. And they need to really start a business. In essence, having a lab is a small or maybe not so small business. It involves hiring people, letting people go. Tell me a little bit about your advice for people who are moving forward with their careers, which will be a very long time, hopefully, in all of our fellows' cases. What are some of the takeaways for you that played a role in your ability to sustain your career over decades, and kind of the ups and downs and how you dealt with those down times?
Mm-hmm. Well, I mentioned passion earlier, and I think it's really a really important element of things. I mean, you can kind of have an intellectual plan, and the intellectual plan needs to be accompanied by passion for what you're doing, just because not everything works. I think one of the key pieces of advice that I got early in my career when I was complaining that a lot of things I did didn't work, somebody said, "Gee, if everything worked, you'd be working on something that was too easy, so you wouldn't even want to bother." I think there's several other things. I mean, listening to advice, getting advice, admitting that you need advice is useful. Establishing collegial interactions with people close to you, next door to you, as well as in your field is absolutely essential. I benefited tremendously from a colleague in a really separate field, still an infectious disease related field, but separate from what I was working on. And he and I just exchanged manuscripts, grants, and we knew enough about the other person's field to be able to sort of read things intelligently, but not so much that we got into the nitty-gritty. But we could just say, this paragraph is really weak. It just doesn't, it just kind of goes in circles. You need to fix this paragraph. And he and I really had a great relationship. I mean, it was no holds barred, and that benefited me tremendously. And I'm still very, very grateful. Um, in terms of extended relationships, a scientific reputation is really, really important. And what I mean by that is a scientific reputation for high quality work and credibility is important. So, like it or not, there is a human element in peer review. And certainly if somebody submits a grant and they've got a bit of a dodgy reputation for kind of over-interpreting data or, drawing conclusions that maybe aren't well-founded, it has an impact on the perception of the grant reviewers. And the contrast is also true. If somebody has a reputation for their work being reproducible, reliable, and really kind of pushing the envelope, but still being well documented, that has a beneficial effect too. I think this is going to be more difficult in the near future, but obviously outreach at meetings, professional meetings, scientific meetings is just a whole lot tougher than it is when you can bump into somebody in between, formal sessions.
I hesitate in asking you this, but I am compelled to do so. This is what I do with the foundation, obviously focuses on communications. So it's a little self-serving perhaps, but how important is communications in your work and marketing?
Boy, much more important than I thought. I kind of embarked on this career, as I mentioned, I was a bit naive, remained naive on certain things for a long time. I kind of took it on thinking, well, if my science is good enough, people will figure it out and they'll appreciate it. And I learned pretty quickly that really actually that's not how it works. I had a very important interaction at one point where my department chair was introducing me to a longtime colleague of his. And he introduced me and he said something about me. And then he looked at me and he looked at his colleague and he said, I actually can't really explain what he does. And that really brought me up short. I thought, whoa, if I haven't communicated effectively enough what I do and why I do it and what it relates to my own department chair, I've got a huge problem. And I think that was an important experience that taught me the importance of communication and marketing.
And you said you were somewhat naive on the subject and you thought if your science was good, people would come to you. Mm-hmm. What was how did you deal with that? The fact that this is your assumption that if I'm doing great work, people will know about it. They'll come to me. And yet for various reasons, many reasons, they may not. Mm-hmm. How did you deal with that, kind of psychologically, emotionally, realizing that? And the story with your department chair is incredible, that here's the person that, in effect, hired you or maybe said, come on into this lab and didn't really fully understand what you did. Mm-hmm. That's pretty striking.
It was. I would say I kind of came into it gradually. I mean, that was a dramatic experience. And, he wasn't even necessarily attacking me or targeting me. He was just, it's a matter-of-fact comment that he didn't actually understand what I did. But it certainly resonated with me. I think I realized over the course of going to meetings that, scientific meetings that is, and presenting my work, I realized that I need to tell people that it's important. They're not going to necessarily know it immediately. I think this is kind of another way I was incredibly naive, and particularly at the beginning. I would go to scientific meetings and give a talk, and I had this horrible neurosis and belief that everybody in the audience knew more about the topic than I did. Now that had some benefit. I mean, it had a detriment because it meant that, I was pretty anxious for presentations, but I think it had also a benefit to me because it made me think, well, I absolutely have to know more about my topic than anybody else does. I mean, I'm the one that's working on it. I think it was in that process that I realized not only do I have to know more about this topic than anybody else that I'm working on, I'm discovering things in, but it's my responsibility to tell people why it matters. And I think that was a gradual process, I think.
You were at the New York University School of Medicine, and you directed the Division of Infectious Diseases and Immunology there, among other duties. When did that occur? In other words, how did you get from 84 and the foundation to New York University School of Medicine?
Well, after my training at UCSF, I joined the faculty and continued my work. It evolved from kind of a balance between clinical work and bench work, and became much more sort of bench focused. I mean, I would still spend, I guess, about 20% of my time doing clinical work. And I had my lab, and it was reasonably well funded. I had some really great trainees, and I loved interacting with the trainees. But I think at one point I realized, I would like to have more of an impact. I'd like to have more of an impact than I can on just the trainees in my lab. And I also kind of realized that our daughters were going to be leaving home to go to school. And realized, if I'm going to ever make a move, I should probably make a move pretty soon. That was just kind of a subconscious thing. I was not thinking, okay, I have to get out of here, or I have to make a move. But I was kind of open to it. And then I was thinking about wanting to have a greater impact. So when NYU approached me about the possibility of the position there, I thought, hey, I should give this some serious thought. First of all, it would be an opportunity to have an impact beyond my own lab. Second, I had pretty much the notion that there were only a few places in the world that I would live other than San Francisco, and New York City was the only other one in the United States that was on the list. And so a conversation with the new chair of the Department of Medicine there essentially then turned into another visit and turned into an offer, and I decided to make the move. There were some people around me here that couldn't believe that I was leaving UCSF. It was, why would you want to do that? It's a great place, and it is a great place. And I knew it at the time, but I just wanted a new adventure. And I think it was a good move. It certainly allowed me to broaden my horizons. It also, frankly, helped me appreciate how special UCSF is, but that's a separate pitch. And I really enjoyed the opportunity to grow a program and to have an impact on more trainees. Frankly, the Division of Infectious Diseases and the discipline of infectious diseases at NYU when I got there was pretty undeveloped. My predecessor had actually been in the position since 1959, and it was a little stale. And so it was an opportunity to, first of all, kind of apply my marketing skills. I realized I had to convince people that infectious diseases were important, because for the preceding 40 years, they'd had the same person in charge, and he wasn't so young anymore. And so they'd kind of gotten used to infectious disease as a discipline not being terribly high profile or not terribly important. So my marketing skills became important at that point. And so I think, it was a tough decision in a certain way. It was attractive. A move, needs to be made balancing the benefits versus the costs. In other words, making a move in many cases will certainly interrupt a research program, for a briefer or longer period of time. I was fortunate that 4 members of my lab at the time were willing and able to move to New York with me, and so they really helped build up the lab reasonably quickly. And so, you have to balance the strengths and the benefits. And, I think the benefit in changing locations is that it gave me a chance to think about things differently. I mean, there were some projects that I just realized, that project has been kind of grinding along and it's not that exciting anymore. Let's just leave it behind. It was a chance to make new connections with people who did things that were different than people around me before the move. And that was beneficial. established a lot of beneficial interactions and relationships.
Betsy Crouch, one of our new fellows, asks, she says that I imagine many of us are thinking about launching our own lab in the coming years. Dr. Ernst, could you talk a little more about your advice to scientists when they are starting their own group? What advice would you have?
You know, my first response to that is find the PDF version of a book that was put out by the Howard Hughes and the Burroughs Wellcome Foundation a few years ago, titled Making the Right Moves. Now, this is kind of an out because it provides a lot of those answers. Google it, it's a free PDF. They handed out the book for years, but I think it went into a second edition, and now it's just available as a PDF. So I'm not just offloading the answer to the question onto that, but it's an essential source of information and, frankly, source of wisdom. It was composed by people who were successful scientists, so there's a selection bias, but that's good. But there is a lot of information there about how to negotiate for a position, how to negotiate for space, how to deal with seniority, how to deal with hiring people, how to deal with getting funding, how to present your science. I think all of those are covered in there, and all of those are things that are important to learn. The other thing I think that's certainly different these days is more and more institutions provide mentoring for aspiring new faculty and for new faculty. And I think that's an extremely positive trend. In other words, I think that institutions realize that if they're going to make an investment, they want a return on their investment, to put it in brutal transactional terms. But the real human way of saying it is, if they bring you somebody into their faculty, they want them to succeed, and they want to help them succeed. And so I think that's another attitude to have. In other words, that actually your institution does want you to succeed. It may not seem like it sometimes. It may seem like they're daring you to succeed. But in fact, people around you really do want you to succeed and want to provide help and support and advice. And those are all important. And then it's a stepwise process. You can learn certain things from your mentor advisors. You can learn other things from your colleagues. I think I was just a sponge for information, and soaked up everything I could find at the time.
I know our board has mentioned that when they're supporting and funding fellows, they're supporting their research and the work they're doing, but they're also supporting future leaders. Mm-hmm. And whether, as Betsy mentioned, having their own lab, there are a lot of ways that our fellows impact their departments, science, medicine, and even the world. One of the things you and I talked about at our kind of pre-interview was when to pivot, when to make a move. Mm-hmm. Do you do it when you're in the dark, the depth of that valley, and things are going poorly and I need to get out of here, I need to make a change? Or conversely, do you do it when you're on the top of your game? Mm-hmm. And those changes, you mentioned your daughters so there were life changes, personal life changes that were accompanying your pondering about this. And I think that's really one of the struggles that people make. They think kind of linearly. Mm-hmm. I'm in science, I do this, this is step 1, step 2, step 3, we're done. It's not like that. It's not a linear path mm-hmm. at all.
There are a couple of ways to think about that. I mean, pivoting kind of career-wise is one thing. Pivoting scientifically is another. In other words, obviously, it's important to have a research theme that people recognize you for and know you for. On the other hand, I mean, I think it's kind of a cliche, but during your career, things will change in such a way that what you end up doing may be something that doesn't even exist right now. I mean, for me, for example, the AIDS epidemic was the first example of that. Really, my career began at the dawn of the AIDS epidemic. And that provided opportunities. And it made me also realize that there were people around me who were pivoting their time, attention, and their research to this new epidemic. And then there were people who weren't. And some of the people who weren't, were very successful at the time. They were good at what they were doing. They were recognized for being good at what they were doing. But then the world changed on them. And what they were doing wasn't actually kind of the hot stuff anymore. So it takes a little bit of judgment. It takes a little bit of experience and maybe a little discussion with colleagues. You sort of see an opportunity and you say, should I pivot my lab to work on COVID-19, or is this going to go away like Zika did? And it's not that Zika is completely irrelevant anymore, but it was a good example of something that came on the scene and didn't have pandemic potential for a number of reasons. And so now, you don't see too many news items about Zika anymore. COVID-19 is obviously different, but for somebody sort of thinking about, do I change what I'm doing in order to work on COVID-19? Is this going to be durable? Is this going to be a sustainable change? Some of that just needs a little bit of discussion. Some of it is, you put your toe into it and say, well, I'll try this project and see if it works out. Whether on COVID-19, I'm just using that as an example. And if it works, good. I think that's one of the things that's exciting about having trainees, is that sometimes a trainee will say, I'd like to try this, or you can say, I'd like you to try this. And one of the features of being a mentor is, I think, an important feature of being a mentor is being able to know when to pivot with a trainee's work and their lives. It can sometimes be technical. I mean, just thinking, for example, of a recent technical advance that is having a massive impact on biology, is just CRISPR-Cas technology. I mean, there is no field of biomedical science that hasn't benefited from and can't further benefit from that as a technology. PCR would have been kind of an earlier version. It's going to be one of those things where it at one point it's really innovative, and in the next point, not that much later, it's what you absolutely have to do. And so some pivoting is always essential. You don't want to be sort of bouncing back and forth between disciplines. You don't want to say, well, I'm trained as an immunologist, but now I think I really want to pursue neurobiology or neuroscience, and then come back again. Unless there's some linkage between those two scientifically or technically, that's probably a little bit too much pivoting.
This whole thing of mentoring, I know at New York School of Medicine, you were a mentor. I know you mentored people at UCSF, but there's two sides to that. It's, how do you become a really good mentor? How do you read the mentee? How do you know how to either nudge along or, it's like the old sports analogy. How do you motivate people, the players? Tough love, or what was your style of being a mentor?
First of all, I never forgot what it was like to be a mentee. I think I benefited, and I mean this seriously, I benefited from bad mentoring. In other words, I think I learned how not to be a mentor by virtue of some mentoring activity that was, I think, not so good. I think I can best answer that question by saying every mentee's different. In other words, some mentees just have absolute, total enthusiasm for absolutely everything, and you have to subdue them. You have to guide them. You have to keep them on course. Some mentees need to be coached. I think of a graduate student that I had in New York who seemed bright, seemed motivated, but also seemed to be enjoying life in New York an awful lot, and was just really slow to get off the ground. And at some point, I got very, very close to just saying, I really think your role in your future is in teaching. I mean, you're good at it, you're good at communicating, but you really don't seem to have what it takes at the bench. And I never said that, and in time that person blossomed and was fantastic. And so I think you have to be cautious sometimes how you assess people. I think you need to meet, I think one of the themes that I use fairly frequently is I never want to tell a mentee something that I would be ashamed of having fed back to me a few years later. In other words, for example, if I had told that mentee, look, you should just get out of this graduate program and go get a teaching job at a nice liberal arts college someplace. And they came back and said, I'm just writing you after getting Harvard tenure and would like to know that I haven't forgotten your advice. I never wanted to be in that position. And so I've been kind of careful and cautious about what I say, how I say it. But again, every mentee is different. I think the other thing that I would offer that can kind of make life more complicated, but in the long run a little bit less complicated, is as you select people for your lab, it's really important to select people who get along with other people in the lab and in the surrounding environment. In other words, somebody may come to you and they're absolutely brilliant and they've got great hands and a great head and a great bunch of ideas. But boy, if they can't get along with other people around them, they're a catastrophe. They just cause you more headaches than you could ever imagine. And so when I interview candidates and I have rotation students in the lab and consider whether they would be good to come back for their dissertations, I pay attention to how do they interact? How do they get along? They don't necessarily need to go out, for a beer every other night together, but they need to be able to function together. They need to cooperate with one another. And I think as a mentor, it's really important to choose people, including that as a consideration.
I think that's one of the things that this whole broadening this up out to life wisdom is kindness, politeness, clarity, pausing. I interviewed somebody on stage at Herbst Theater in the city, and my daughter, who was maybe 10 or 11, was up in the audience, and I asked the author a question, and he paused. And in radio, you don't want any dead air. You want to keep the thing moving. He paused for quite a while. It might have been 45 seconds or something. But so I asked my daughter, what did you think about that? And she said, Dad, it was fun watching him think. And I think those pauses, those moments when you let other things in, whether they're just a reflective moment or a pondering moment or something, we're going awful fast. Mm-hmm. And I think that those moments, and then maybe coming back to it. Mm-hmm. Hey, we talked yesterday, and how did you feel about that? What was going on? So there's a whole personal side, and then we can expand that into collaboration. Many of our fellows are collaborating with scientists at their own institution, other institutions, and all over the world. Real collaboration where they are working together on some kind of research. That has to be very different from when you were beginning your career, that global collaboration.
I think that's a really good point. I think one way that things have evolved and changed in a really good way over time is that very thing, and sort of the theme of team science. I think when I was a trainee and just starting out, the mantra was you have to show your independence. And in a way, over-interpreting that meant, well, you really shouldn't be cooperating or collaborating with anybody that's, got any kind of a reputation at all. Otherwise, they will get the credit. And I think that was a theme that was overplayed at the time. And I'm very, very glad to see that that's largely obsolete. You still have to be recognized for your contributions and your excellence and everything else. But I think collaboration and cooperation certainly has become an essential component of being a biomedical scientist. It's also fun. Good collaborations are just fantastic. I have had collaborations where there was synergism that led to more excitement than anybody could have probably ever predicted in advance. Not every collaboration works out as smoothly. And I've had some that just didn't work out particularly well and that were rather difficult. But I think I've learned also how to how to negotiate and how to figure out in advance, what's something that you really want to throw yourself into in terms of a collaboration or not.
We're almost at the end of our hour, and I want to ask you a couple of other quick things. One not so quick, but when I ask fellows, the ones that I've worked with 5, 6, 7 years ago, what's the impact of the foundation's support? There's a kind of a narrow period of time there.
Mm-hmm.
As you look back, how would you quantify, how would you describe the impact of the foundation's support for you those many years ago? Is there an ongoing thing, something that has kept with you, stuck with you?
I mean, I think there are several things that I think about in that regard. First of all, I'm not sure I would have had a scientific career if I hadn't gotten the Giannini Fellowship. I had a backup plan, but it didn't involve research fellowship funding. So not only did the financial support help me launch my career, I think the other thing was just the morale boost that I got from actually having gotten the fellowship. I thought, wow, somebody figured that I might actually amount to something. This is really great. So I think those are kind of coupled. I mean, and maybe in a certain way, the second one is even more important. I mean, the financial part was essential, but the validation that somebody looked at me critically and what I was thinking about and thought it just might work out was a tremendous boost, frankly. I think going forward, I mean, this may sound funny, but when I look at people's CVs, whether it was for various faculty positions, whether in New York or here or something like that, and I look in their background and go, ha, they had a Giannini Foundation fellowship. There's a certain kind of bond there. I think, well, that is really cool. And I think I've surprised some people by picking that out of their CV and talking about it when I interview and things like that. But I think, the foundation's had a tremendous impact, obviously now on an accumulated pretty large fraction, a large number of people. And, and people have gone on to do very, very well in their careers. So I think the foundation certainly plays an important part, both by the financial support and by the boost from saying, we're validating